All right, welcome back. That was just a bit of background information on what you need to know about in vitro fertilization, and we have a doctor with us here in Lagos.
All right, yes, of course, we have a person, the consultant and gynecologist and obstetrician, an IVF practitioner, and also a medical director for Kingsville Hospitals and Fertility Center. And that's a person of Dr. Kingsley Onwuzurigbu. Good morning, sir, and welcome to Galaxy Today.
Good morning,
It's
and
good
good
to have
morning,
you.
watchers and listeners.
Okay, sir, so we're looking at IVF. A whole lot of people get it all mixed up once you say IVF. Yes, some people know it's in vitro fertilization, but a whole lot of people are still not well informed about what it is. So let's start with what exactly is IVF?
Well, as the name goes, IVF just means in vitro fertilization.
Okay.
What occurs naturally is in vivo fertilization.
Okay.
In vivo means it occurs inside the body. In vitro means outside the body.
Okay.
That is just what it means. And fertilization is fertilization, irrespective of wherever it occurs. Okay, but the good thing about IVF is after the fertilization, there has to be the transfer of embryos into the uterus. And then pregnancy test is done 2 weeks afterwards. So that's just what IVF is all about.
Oh.
Okay, but then again, let's look at it here. Let's bring it back home in Nigeria. How popular, how acceptable is this particular mode of fertilization?
Personally, I belong to a lot of social groups, and I've always mentioned that the populace, the general public, have to be educated about fertility. Assisted conception. There are a lot of myths, there are a lot of misconception about assisted conception. Some people feel it is unreligious, some people feel it is, I don't know, they just have a lot of bad impressions about it. But I have always told people that this is something that has developed out of science, and I believe as a person that science is designed to provide solution to human problems. So the populace, religious bodies, traditional institutions, market women, there has to be a public enlightenment on issues that have to do with provision of assisted conception. There's nothing wrong about it. It's God that designed it. Currently, I can tell you that every fertility problem has a solution.
Really?
Science has almost provided solution to every problem.
So there is no excuse for not having children.
It's just for you to choose the one that you want, and so are some that are people are restricted in going into it because of their religious inclination. But by and large, there is a solution.
Okay, so I like the fact that you said that possibly there is solution to
Yes.
fertility.
Yes.
Now, let's go to extreme cases where we have cases of women who, they say they have no womb. They
Surrogacy.
have no surrogacy. Okay.
See, there's a solution.
Okay.
You borrow a womb.
And the child carries your DNA.
Yes. I had one recently. The woman has a condition they call Rokitansky-Meyakusa-Huster syndrome. It's a
Okay.
condition, I don't know what is the medical term.
You have to break
But
it
any
down.
doctor listening to me, any gynecologist listening to me will know what I'm talking about. She doesn't menstruate.
Really?
The uterus is blindly ended. There's no communication between the uterus and the vagina. But she has ovary.
Okay.
So when you stimulate the ovaries, she produces eggs. So we retrieve the eggs, fertilize with the husband's sperm, and transfer to a surrogate. When the child comes out, it's their child, it's their gene, it's their genetics. Because there's no womb, so you look for a womb to carry the pregnancy.
I see.
So that is a solution. So they're able to have their own child, their genetic child, irrespective of the challenge that they have. So as I told you, there has to be public enlightenment and public awareness about this.
Okay, I really understand that a lot of people have different myths and different misconceptions. Specifically, one that I have heard over time is that if the baby was not actually born from your own womb, speaking about the woman now, that there might be, there's this mother to child relationship might not really be there. How true is it?
It's not true. It's just not true. The gene belongs to the gametes that are used for the IVF. Okay? And the child just knows the person that carries him or her from the time the child is born. If I born a child now, deliver the child doesn't know whom the mother is. If I give the child to you and you start breastfeeding the child and everything, the child will resemble you. Doesn't remember where he came out from. So it's not true.
Okay, so I'd like us to look at IVF. What are the other benefits of IVF? I've heard people say that for genotype selection, IVF too is wise to try.
Yes, as I told you, science provides solution to problems.
Okay.
There is something called pre-implantation genetic diagnosis.
Okay.
And what happens is after fertilization and the embryo starts cleaving, when you get to either the blastome or blastocyst, the 3 or the 5 embryo, you do a biopsy of that embryo and you send it for genetic analysis. So we send it for genetic analysis, you'll be able to know the genotype of that embryo. So if you can even know the sex of the embryo from that's what they do for sex selection. So if like two couples that are ASAS get married and they don't want to have a sickler, what you do is to do IVF and do PGD, pre-implantation genetic diagnosis. You biopsy the embryos and send the biopsied embryos for genetic analysis. It will tell you the embryos that are AA, the ones that are AS, the ones that are SS. And then the clinician will choose the ones that are AA and transfer. And if the pregnancy results, there will be no sickle.
Okay, well, that's wow, that's very amazing. But another thing I really need to understand: IVF, is it just specifically for people who have fertility issues, or just because I've heard some people say that they specifically want to get twins or triplets, and IVF is an option?
The issue of twins and triplets depends on the number of embryos that you transfer.
Okay.
Okay.
So why do you want twins and triplets? That's the issue. It depends on the number of embryos transferred. There are some people now that are talking about single embryo transfer in some places which many of us may not believe in. In UK, they don't think they transfer more than 2 embryos. Well, in Nigeria, we have not fixed any ceiling on the number of embryos to be transferred. The issue is that you have to be careful in the number of embryos. You have to develop a practice. Yes. Because if you are a person that transfers only 3 embryos and you find out you are having higher order multiples every time. Every time you're having triplets, you're having twins, you're having quadruplets, because there's one I had, I transferred 3, 1 split, they ended up delivering 4 babies, 2 boys, 2 girls.
Wow.
So when you start having issues like that, it means your life is so fine, so good and all that, they have to decide to do a reduction in the number of embryos that's transferred. So those that want, some people come, they just want, why should you go and do IVF just to have twins and triplets? I mean, if you can conceive of your own.
Maybe the case of age.
Well, if there's an indication for IVF,
Okay.
you come for IVF, and if you want multiple pregnancy,
Yeah.
you need to be counseled, because multiple pregnancy is not easy. There are obstetric complications associated with multiple pregnancy, starting from preterm delivery. Preterm delivery, hypertensive disorders of pregnancy, eclampsia and the rest. Okay, so it's not placenta previa, okay, abruptio. So there are a lot of obstetric complications that may be associated with high order multiples. It's a high risk pregnancy. So it's not something you just say, I want this and that. But when it occurs, then the task lies with the obstetrician to be able to handle the case. In some countries, I say the science has provided solution to every problem. I'm just talking as a scientist now, not putting religion in case. There is something called embryo reduction. Some people will say it's killing, some people say it's abortion, but I'm talking about science now. Let's think about what people think about it. It's a situation whereby maybe somebody has 7 embryos. That's the case, 7 embryos. I mean, the risk are so many. So they reduce some. I know what they do. It's a very simple procedure for those that know how to do it. Okay, they just inject KCl into the heart of the baby, some of them, and that reduces the embryo at an early stage. So they save the woman the risk associated with higher order multiples.
Okay.
Okay, so let's look at age now. Is that an age barrier for IVF?
Well, yes and no. In some countries, they will discourage you from doing IVF at a certain age. But in our country, there's no, as I told you, we are still working on the ethics. At least I happen to be a member of the ethical committee of the Association of Fertility and Reproductive Health. Start trying to pick up ethics in this country. I think that was where we discuss all those. But by and large, you have people above 60 that have delivered for
Successfully here in
59
Nigeria.
years. Well, some claim, I can talk about claims in Nigeria because I didn't authenticate. The highest I've had in my place is 57. Yes, but it was a donor egg anyway.
All right. Okay, doctor, we'll come back to you. Now, let's just go to Ibadan. We have Dr. Chinedu Onebune, a senior registrar at Department of Obstetrics and Gynecology, University College Hospital, Ibadan. Good morning to you, Dr. Onebune. We're looking at in vitro fertilization. I really want to get specifics concerning the success rate in your location. How acceptable is it in Oyo State, and how many incidences do you have at UCH on a regular basis or on the average? On the average.
Hello, thank you. Good morning. There are different facets to your question. The topic is IVF, in vitro fertilization, like you said. Acceptability is varied. In our center, currently at the moment, there is an allocation for a specific IVF center, which is ongoing at the moment. So at this moment, I can't give you any values about that. So which is why I cannot report for UCH. However, there are different places, even in Oyo State, where in vitro fertilization is being performed currently. So the acceptability, the problem with IVF a lot of times has to do with money, because it's a relatively costly procedure, and it's not, the cycle is not 100% issue. You can't say for certain that in 100% of cases, of each cycle, you're going to get pregnant. So it's still something that you have to try and see. The success rates vary, so that affects the acceptability, because a couple that is coming that I want to get pregnant, and you're saying that even though the chances are improved with IVF, it's still not 100%. So it affects them if they check their pockets and they think it's something they can go ahead with. It affects that. And then there are other issues with it. Some people have religious facets to it. Some people have even cultural facets to it, which is affecting the acceptability. But by and large, it's relatively seen as the procedure for the rich. If you have money, you get like my senior colleague said in the studio, it's more like there is no issue with fertility that doesn't have a solution. But in this particular situation, it's how much you are willing to accept the available solution that is offered to you, and let me say how willing you are to go the extra mile. Some people have to borrow money to come for an IVF cycle. So if you borrow money to come for the cycle and you realize that it's possible that within that first cycle you don't get pregnant, and the downside is that it's for the particular couple, each extra cycle the success rate is improved. So assuming you've done the first time and it failed, the second time is more likely compared to the first time to succeed. So we advise people not to bring money for just one cycle, because it's not going to be fair on your own side, because what you want is a pregnancy and a live birth, not just being pregnant, carrying it to term. So that affects the acceptability and the how do I put it now, the ways they see it in terms of the couples. I hope a little bit clear on this issue. In Oyo State, I can say it's acceptable for those who have the money, because it's not even something that is covered by insurance. So it's not one of those things, for example, NHIS covers. So these are issues that even in the developed countries is not even covered by insurance, especially some specific countries. So it affects the supposed acceptability. However, if, for example, there is someone willing to sponsor someone, I don't think there's any particular couple with infertility who are offered the chance of IVF with its increased success rate who are going to really say no, at least at this moment, because here we value children in Nigeria as a whole, then even in this part of Nigeria, children are very valuable, especially your own children. So every couple will want to have a child they can say, this is mine, as much as possible from my loins. But it varies. Every couple will want.
Said that, but I'm still talking about awareness level. Do you think the level of awareness in Oyo State is that much? Because you say that it is only those who can afford it that are involved in it. How about those who cannot afford it? Are they aware? When I mean awareness now, what's the level of awareness in Oyo State?
Okay. All right. Answering that question is going to be slightly tricky because, you can look at awareness in terms of those who need the intervention, and if they are aware it is there, then those who are regular passers who may not even be married, may not even want fertility at that particular time, or may not even have a problem with fertility, but are they aware? For example, let's say there's a couple that are infertile. Are they aware that IVF is an option for them that can be assessed if they have money? That's one angle. The other angle is there's a couple who is fertile, but do they know that this actually is obtainable? There is a market woman who is fertile, for example. Does she know that there's something called IVF that those who, so it means, can she inform someone else if she knows? So for those who are infertile and are seeking health interventions, who have gone to hospitals, because once you get to a hospital, a regular hospital, unless you do not go to a hospital, but once you go to all these traditional places, you're looking for traditional solutions. But once you've got to a hospital, a high percentage of those couples or individuals eventually get to know about IVF. So you can say that the awareness in that subgroup is fair enough. Now, what they now do with it, like I told you, acceptability, the issues are surrounding it now varies. But for a regular passerby, if you decide to conduct a survey, maybe like what is obtainable these days, all those kits you see on social media, you just stand and ask people, what is this, you actually get very fascinating answers. So in that regard, a high proportion of the population are not aware. Now, it's like asking, it's not like malaria. Everybody once in a while has an issue with malaria, so you shall have some basic knowledge about malaria. So you are aware. But in this particular instance, someone who has not had any brush with infertility issues in this environment is, I can say, generally unaware, except maybe they have health workers as their relatives or friends, or they have people working in any of those centers. So maybe the conversations moves to that angle and they eventually hear about it. But saying that I don't know how many of these shows have been done about IVF. That's how people get aware. They're not in school. They're not being taught that. So they really would not know from any angle. Is not that common in newspapers. It's not what is trending in social media. And these are the places available for people to get informed about it. So I can see, even though I can't give you figures. If that's what you're asking for, I can't give you figures. But really, the common man in this side is not aware, except that person has had need to assess or seek care relative to fertility or infertility. So I think that's a fair representation of this environment. Relative to fertility.
Thanks to Dr. Chinedu Onebune. He's a senior registrar at the Department of Gynecology and Obstetrics, University College Hospital, Ibadan. Thanks for your input on the show today. We do appreciate it. Now, back to you now, Dr. Kingsley. I need to find out two things specifically. Now, he mentioned that of costs. Why are the procedures for IVF that costs, not cost unfriendly? And secondly, is it just specifically for women with infertility issues, or even men with maybe issues of low sperm count or others?
Yeah, I will start from the second question.
Okay.
IVF is for both men and women. Okay. Men are lucky in that technology has been developed in such a way that even men with just one sperm can do IVF, and then we're able to achieve pregnancy. That's something they call ICSI, intracytoplasmic sperm injection, in which you just need one sperm to inject into one egg. So injected, the egg may just survive, the embryo may just survive, and you have a pregnancy. And the problem we have in this part of the world is that people see fertility as a woman problem. It's not true. It's a couple problem. When I was in India, the clinic where I did my training, I will be there again. I'm going for a conference there as an international faculty in 3 weeks' time. Couples come for fertility treatment, not the woman. When the woman is coming, she comes with the husband. So it should be seen as a couple problem, not a woman problem. That's a problem we have in this part of the world. And it becomes worrisome when it's actually the woman that has the problem. The man will show no interest. Okay, so it's not only women that have problems. There are men that have problems. In fact, there's an increased incidence of low sperm count in the environment now, which nobody has been able to explain the rationale behind it. It is men with very low sperm count, 50,000, 10,000, 5,000. And even some people who just come do a sperm test is normal. After a while, find out that it's very low, which we are trying to find out what is becoming responsible for this low sperm count. Even the sperm count will be okay, but the other parameters, the motility and the morphology, are not something to write home about. And all this impact negatively on the outcome of the IVF. So it should be seen, men also have problems. That's what we have to understand. And the problem from men is rising in the society. So it should be seen as a couple problem, not a woman problem. Then coming to the issue of cost. Cost is a relative term, as far as I'm concerned. What may be expensive to you may not be expensive to me. But generally, things are expensive in this country, generally. It's a general thing. The increase in dollar made things more expensive. For example, I was opportune to train or be a part of an association in Asia where they talk about low-cost IVF. Okay? For example, IVF, maybe let's take for example, someone was charging $3,000 in the year 2015 when dollar was 170 naira to $1. And you want to charge $3,000 now, still. $3,000 now is 1.08 million.
So it's actually chargeable in dollars?
No, I'm just giving an example. There's nothing you can do about it.
Okay, true.
And the problem stems from the fact that almost everything used in IVF is imported. And you buy either in dollars or euro. So when there is an increase in the exchange rate, most times the prices of things in this foreign currency has not changed. But because of the increase in the exchange rate, the price in naira changes. You will have no choice but to increase the price. There are no local production. There is no local manufacturing. Even the simple dishes that are used in the laboratory, everything is imported. Pipette tips, imported. Everything. So that is part of the problem. If you a place like India now, they manufacture a lot of things. India manufacture their transfer catheters, they manufacture IUI catheters, they even manufacture some of their gonadotrophins. Okay? So if you want to actually come down to the masses, you can say, okay, let's use these locally produced drugs and other materials and accessories. It will actually crash the price. Okay, the success rate may not, I said may not be as fantastic, but if the difference is not significant, it will help in solving the problems of the poor in the society that cannot afford all the things that are going to import. But here, everything is imported. So that is where the cost comes from. Okay? Then other things, people are doing a lot of things to reduce the cost. Well, especially there are so many areas where the cost can come down. But there are some things, personally, there are some things I will never compromise. Okay. I will not compromise on my media. I will not compromise on the laboratory work. I will not compromise on the catheter. I will not compromise on the drugs used for stimulation. Okay. The only thing that we may do is that you stratify patients based on their age, their ovarian reserve, and previous response to stimulation. And when you do that, you can be able to calculate the minimal dosage of drugs that may be used for stimulation. They may be able to get some discount on that drug. Apart from that, it may be difficult to come down on cost. Another area is people that do donor egg program. They can do a shared egg program that will reduce the cost. So we always try to find ways in between to be able to see how we can assist patients. Because what we talk about over the world now is individualized care, not just a general care for every patient that comes to the hospital. Actually, in my place, you rarely can find two patients that pay the same amount. Because when you come, I assess you and I will tell you what your price is going to be so that you can help patients out of this predicament.
Okay. So